Deputy McGuinness, thank you.
In light of the statistics that the Minister has put before us and the figures which are designed, I suppose, to baffle and mislead, let me tell you this. Margaret, who attended St Luke's Hospital today, says, "I had a reason to spend a good part of yesterday, Monday, November the 9th, in St Luke's Hospital in Kilkenny. There were lines and lines of people, all in need of care and attention, queuing at the medical assessment unit. People were waiting to be seen, some were awaiting tests, others results. Some were waiting for beds and a decision to be made in that regard. Patients were waiting on chairs and trolleys and in wheelchairs. People accompanying them stood for hours and eventually sat on the floor. There were so many people that the staff literally didn't have room to turn. They continually had to excuse themselves just to work. Under these appalling conditions, staff heroically and unselfishly ploughed on and helped and cared for people professionally with empathy and kindness. Thanks to all the staff," and she thanks the staff, and then criticises successive governments for not investing fully. Now, this is in a hospital that Eamon O'Queeve has said earlier on, Deputy Eamon O'Queeve, that it was the lead hospital in terms of development and in terms of the delivery of services in the country. And that is happening in our hospital, while yards away from where people are being admitted, there is a brand new unit that was opened and closed, and that could ease the pressure in relation to this, and the staff are not being provided. Now, it is the nurses and the frontline staff that are a band-aid in that system that are holding it together. Meanwhile, while that unit lies empty and not being used for what it was built for, you have Kilkenny Hospital, where the HSE has decided to run down the services, and look to an overcrowded campus in Waterford Regional Hospital. It is absolutely chaotic, Minister, chaotic in terms of the treatment of patients, and there is no respect being shown for the dignity of those patients by the system that you represent, by the HSE and by the Department of Health. And it's shame on them for putting patients and staff on the front line in this particular predicament. It is about management. It is about using the resources that you have. And in St Luke's, you are doing neither, and you're ignoring the issue in relation to Kilkenny Hospital. Another lady that contacted me today said her elderly parent was in bed and asked for an extra sheet and blanket. And the nurse leaned in and quietly and politely said to her, "Your best bet is Dunnes Stores." What kind of a system are you running? There's a shortage of bed clothing. There is now a new arrangement in terms of hospital stores, and these essential items cannot be accessed easily. There's a shortage of staff. Stroke victims and elderly, and those that are in deep shock that attend A&E, are being left without the care and attention that they deserve and require. The staff have complained to management long before this happened, and they were ignored. Ignored to the extent that you now have chaos. How can any management team in any hospital in the country stand over that? And again, when you look at the funding, because that's what the remark that you made in relation to the hospitals, you stand over the HSE that has now have to pay out compensation of €9 million to suppliers just because they broke the rules and didn't meet the criteria. You stand over a HSE that cannot collect its own debt from the private health insurers, not because the private health insurers won't pay, but because your consultants won't sign off on it. How many hospital beds would be in the wards? How many patients would be off the corridors? How many sheets and blankets and pillows could you provide for a hard-pressed service if only the management that are well paid would collect the money and reinvest that money in the services on the front line? I suggest to you that we should look at what's happening in the UK now, where they're going back to the cottage hospitals, where they're easily managed, where there is no MRSA or no infections, and where those that are elderly and in dire need of the service get it when they want it. But it's shame on any government and this House that the elderly and the sick should be left the way they are in our hospitals throughout the country.